If you're a healthcare professional, you've seen it. You're living it. A really noticeable rise in neuropsychiatric conditions. But the real challenge, the one we're all grappling with, is trying to figure out what's driving it. And that's exactly what we're going to unpack today.
So this is the core question, isn't it? We know there's an increase in these illnesses. That part is undeniable. But is what we're seeing the long-term fallout from the virus itself? Or is it somehow connected to the global response, the countermeasures we rolled out? It's a tough diagnostic puzzle.
All right, here's how we're going to tackle this. First, we'll lay out the problem, this tale of two syndromes. Then, we'll look at two very different streams of data. First, we'll decode the vaccine signal from reporting systems. Then, we'll map out the symptoms we see after a COVID infection. And finally, and this is so important, we'll put it all into context before we wrap things up. Okay, let's set the stage. Since 2020, anyone on the front lines has seen this troubling spike in mental and cognitive health problems. It's created a real sense of urgency to find some clear answers.
Yeah, we're talking about everything from that persistent brain fog and memory loss to crippling fatigue and anxiety. To really get a handle on what's going on, we have to look at this objectively, and that means examining two very distinct streams of evidence.
So let's jump into that first data set. We're going to look at pharmacovigilance signals. Specifically, the adverse events that were reported to the official monitoring systems right after the COVID-19 vaccinations. And the main source for this is VAERS. Now, it's really important we're all on the same page about what VAERS is. It's the Vaccine Adverse Event Reporting System. Think of it as an early warning system run by the CDC and FDA designed to spot potential safety problems. It's a signal generator, right? It tells you where to look, but it doesn't prove causation on its own.
And inside VAERS, one of the key tools that used to find these signals is the proportional reporting ratio, or PRR. It basically compares how often an adverse event pops up for one vaccine versus others. And here's the crucial part. The CDC and FDA have a rule. They state that a PRR of 2 or higher is officially considered a safety concern that needs more investigation.
So what does the VAERS data actually show? Well, brace yourself. According to one analysis, when you look at cognitive impairment, the PRR was 118. Let that sink in for a second. The official safety signal starts at 2. This is 59 times higher than that threshold.
It doesn't stop there. For general psychiatric illness, the number was almost identical, a PRR of 115. And for the most tragic and severe category, suicide and homicide, the PRR was still a staggering 80.1. So when you look at these numbers together, the pharmacovigilance data is sending a very, very loud signal. Okay, now let's completely switch gears and look at our second data set. We're moving away from the vaccine safety signals and asking a different question. What's the prevalence of these same symptoms in people after they've recovered from a COVID infection?
And this brings us to the other side of the coin. There's a whole separate body of work. We're talking large-scale meta-analyses that has been trying to figure out just how common these neuropsychiatric symptoms are in the months after someone gets over the initial infection. And what they found is pretty sobering. A 2021 meta-analysis showed a really high prevalence of these persistent symptoms. The numbers are huge, more than a quarter of patients dealing with sleep disturbances, almost as many with fatigue. And about 1 in 5 people had objective, measurable cognitive impairment up to 6 months later. So this makes it crystal clear. The virus itself carries a heavy neuropsychiatric burden. Okay, so we have two very compelling sets of data, and they seem to point in different directions. But you can't just look at these numbers in a clinical vacuum. To have any chance of understanding this, we have to zoom out and look at the whole picture, the policy, the institutional behavior, and the absolute erosion of public trust. And a critical piece of that context is the PrEP Act. This law is so important because it basically gave broad immunity from liability for any medical countermeasures used during a public health emergency. This fundamentally changed the entire landscape of legal and financial risk for the companies involved. And this legal distinction is really at the heart of so much of the debate. As this source document points out, by legally classifying the vaccines as countermeasures, it allowed them to be rolled out under an emergency framework that looked a lot more like a military operation than a standard public health program. Critics say this move sidestepped a lot of the usual checks and balances. On top of all that, the official public health guidance was shifting under our feet constantly. I mean, just look at this table. It's a highlight reel of reversals. Remember when early intubation was the standard? Now it's a last resort. Remdesivir was the solution, until it wasn't for many patients.
and the mandates for boosters for all ages. That was later followed by FDA warnings about myocarditis risk in young men. This constant change made it incredibly difficult for anyone to know what to believe.
So here's the kicker. These intense scientific debates weren't happening in a high-trust environment. They were happening on top of a growing crisis of faith in our big healthcare institutions, a crisis fueled by very real, documented failures.
And for a textbook example of this, just look at the 2026 Department of Justice settlement with Kaiser Permanente. It uncovered systemic fraud. We're talking about pressuring doctors to go back and add or exaggerate diagnoses, a practice called upcoding, all to squeeze more money out of Medicare, often without the patient ever knowing. When something like that becomes public, it just shatters the foundation of trust.
And that brings us to our final section, where we have to try and put all of these tangled pieces together and just face the incredibly complicated picture that we're left with.
So, after all that, where are we? Well, we're staring at three competing realities that are all somehow true at the same time. First, the official safety monitoring systems are showing massive, undeniable signals for neuropsychiatric events. Second, the clinical research shows a huge burden of the exact same symptoms in people who just had the virus. And third, all of this is playing out in a full-blown crisis of trust, where politics and proven institutional misconduct make it almost impossible to interpret any data clearly.
Look, there's no simple answer here. There might not be one. Instead, what we're left with is a fundamental and I think deeply challenging question for every single one of us in medicine and public health. In a world where we have more data than ever before, but less trust than we've had in generations, what is the path forward? That's the question we all have to confront.